So who's the best candidate for a penile implant? Do porn stars have penile implants? And who is actually not a good candidate for a penile implant? And how about taking it to the very basic, what is a penile implant? Today's conversation is with Dr. Justin Dubin from Memorial Healthcare System in Miami. He's one of the foremost leaders in penile implants and male sexual health. He is a fellowship trained urologist from Northwestern University, did some training in Miami University, originally from the Northeast. And he is an amazing physician, knowledgeable in this field. And so we have a very thorough conversation on all things penile implants. You know, who's the right candidate? We did have a conversation about porn stars, and because he's in Miami, so he gets to see many different types of patients as it relates to erectile function. So enjoy this special conversation with Dr. Justin Dubin. Let's go. Before I proceed, I just want to clarify that this podcast and all Dr. Gio content is separate from my faculty position at NYU Langone Health. The views and opinions on this podcast are my own. Our guests and sponsors are curated by me and not affiliated with NYU Langone Health. Sponsors are a way for us to provide high quality information at no cost to you so that you can take better charge of your prostate health, testosterone, and erectile function, and also how to live better with age. Now, please join me in welcoming our next sponsor. Before we begin with our podcast, I'd like to thank our two sponsors for this month. Boston Scientific, leaders in penile implants through their technology, AMS 700. Ask your physician and practitioner on Boston Scientific's penile implants. And XY Vigor, Mr. Happy XY Vigor, leaders in dietary supplements for male health, and XY Vigor for male sexual health. Enjoy the podcast. Welcome to the Dr. Gio podcast. I am your host, Dr. Gio, and you know the goal. How do you optimize your prostate health, testosterone, penile health, and live better with age? Today, we have our friend. He's been here before, Dr. Justin Dubin. Justin, thank you so much for being on. I really appreciate you.
Gio, thanks for having me on again. I had such a great time last time. Just a quick shout out. We've recorded an episode for our podcast, Man Up. So I'm excited. You guys are going to love that episode. I learned a whole bunch. So I'm real excited to come back and talk with you today.
I appreciate that. Go ahead and tell the audience about Man Up a little bit. Actually, I love the podcast. I love being on, and I thank you guys for inviting me. Tell our audience about Man Up.
So Man Up is a doctor's guide to men's health. And our goal is to really trying to destigmatize conversations in men's health. As I've talked about, as you know, Gio does a wonderful job, and a lot of our other colleagues that have been on my podcast and his podcast have highlighted, guys don't want to see the doctor. They don't want to go to the doctor. They're scared to go to the doctor. So they often go online and they get bad information. Fortunately, we have people like Gio here, who has a fantastic podcast to educate people and provide a good resource for people who want to learn more about their health and improve themselves. Now, a lot of the resources online, unfortunately, are not given by healthcare providers like ourselves. And so, there was a space and a need we felt. So every 2 weeks, we talk about a men's health topic, from testosterone supplements to improving your sex life to being this week's episode where I don't know when this is coming out. We have how to be more mindful in the bedroom. So nice. It's a biopsychosocial components that we're tackling on a biweekly basis for your information. So it's been really great, and that's the Man Up Pod.
The Man Up Pod. Yeah, thank you. I found it to be. I get some streams on Instagram. I'm like, man, these guys are doing a really good job. So and you're right. There needs to be more conversation, more good conversations. I do love the internet, I have to say, but I have children, right? So I see the ill effects that the internet has on kids. I see it firsthand, right? So is it better than not? I think that boat has sailed. Who cares? But I do think life is better with the internet. I like having information on my fingertips, and hopefully I can decipher what's good information from bad information. I hope, as it relates to our work, I think I could, but there's other things that I have no idea. It's addictive. There's no question for everyone. I don't care who you are. I don't care how disciplined you are. I mean, you really need to be disciplined to get off of it, actually, because I remember back in the day, and not to completely digress, right? But I remember back in the day, I was like, before the internet, I was like, okay, I have my schedule for the day that included watching 30 minutes of TV or 60 minutes if it's a documentary. I love documentary. And wow, great. That's, you had it scheduled, put your VHS, if that was the case, right? Whatever the case was, or recorded if it was something coming on PBS or something. Now you have access to whatever. So it's not necessarily crappy stuff all the time. You just have access to everything. So you can stay, and Netflix has that down, right? Next episode, before even the credits come out. And I'm like, yes, that's right. You're just binging. And you still, it could be the history of the Civil War, whatever, and it's interesting, but man, you're spending too much time on that. So the internet and technology is very, very tricky. More than ever, I think we have to do a better job. And as it relates to sexual health, man, a lot of crappy information out there. If they say better than you, more energy, a little zing, a little hook, they're going to get more attention than you. And you're the legit guy who sees these guys every day clinically, have done the research, written papers, but they'll get more attention than you. So we're trying to change that here. Dr. Geo Podcast, Man Up Pod. We're trying to change that. So yeah, thanks for doing that. We're talking penile implants. It's a fascinating thing to me, by the way. When I first started urology, Justin, I don't know if you know this. Remember, I went to naturopathic school, naturopathic medical school, right? So I'm not a traditional medical doctor. And when you become a naturopathic doctor, you become a general practitioner. No one does what I did, right? Kind of specializing. I just got really lucky, and thank God, because it's like you have to learn so many things. It's like, I don't want to learn all these conditions, what to do naturally, what are the pharmaceuticals, what are the I don't want to do that. The very first person that introduced me to urology ever, who said, Gio, where are you going? I was still in medical school doing some rotations. Where are you going? We were neighbors. No, I'm going to medical school. I have to go to Connecticut, living in New York. Oh, all right. Well, if you want to do one, do it with me. Yeah, sure. What are you, a urologist? Where? Washington Heights. Really? And so you're a urologist? Yeah. At the time, he did a lot of penile. He still does, and I'll tell you the name in a second. But he also did prostatectomies and BP and TURPs and things. Wow, sure. I went there. Now we're talking, Justin, 2001, and I never looked back. From there, I went to Columbia, then NYU. Robert Valenzuela.
Oh, really? That's
Robert Valenzuela.
Very cool.
Got me started in the world of urology. Who's a premier penile implant expert, right? Around the country, certainly in New York, around the country. So I am fond to the process. I saw many penile implants back in the day. It's like, things are different now, I think, but I saw many. And I'm like, this is cool. I will never do that procedure, but man, this is cool. So the follow-up, saw men happy. These, Dominican guys who, are older, probably have very young girlfriends in the DR. They were super happy, quality of life better at the time. And I had this conversation with Carrion and Crespo, the Dominican actor who made it famous in the Spanish world. Andres Garcia, good looking guy. You got to look up this guy. I mean, I'm good. By the way, it's La Pompita in Spanish, right?
Oh, yeah. Right. I'm in Miami.
Yeah, exactly. Right.
70% of the people call it.
So Andres Garcia, it's like, Bob Dole for Viagra kind of thing. He's like, yeah, La Pompita, and marketing it. I tell you that these guys were coming like you're giving out free candy. And they were like, even without a real problem, good looking guy, light eyes. I mean, and this guy's the man with this thing. I want one.
He's a good looking dude.
Where do I sign up? Right? Dude. He's had like two revisions. Revisions. And Carrion, so who was the first one to do it? Was Dr. Carrion Sr. in Miami. He did one of the revisions. In any event, so then Robert Valenzuela had a lot of guys. So this is my first go in urology. It had a lot to do with penile implants. So
beautiful thing.
Let's get right to it. So Justin, let's start with the very basics. Like, what is a penile implant, penile prosthesis? What is it? And let's start there at a very basic level. Hey, friends. This month is our 4-part series on the Dr. Geo podcast on male sexual health. And with that in mind, I'd like to thank our sponsor, Boston Scientific. I'm so excited to collaborate with Boston Scientific, a leader dedicated to transforming lives through innovative and medical solutions that improve patients' lives and health globally. Erectile dysfunction, ED, it's a common condition affecting 1 in 5 American men as young as 20 years old and older. If you have ED, know that it is treatable with various options such as medical solutions, natural solutions, lifestyle changes, medications, vacuum devices, injections, and penile implants. Boston Scientific's AMS 700 inflatable penile prosthesis is a long-term treatment designed to closely mimic a natural erection, providing rigidity when inflated and a natural flaccid appearance when it's deflated. To learn more about ED treatment options, visit the link below, ED Cure, or ask your healthcare practitioner for the best treatment options for you.
So a penile prosthesis is a surgically implanted device. It's a prosthetic device that can really help men with erectile dysfunction. You know, the implant, which is important, it's not outside. It's not like a brace. It's not something that people can see. It is hidden inside of the body, and it can really be used at any time without much planning or waiting. So and in many ways, your penis looks like it did prior to surgery, and it functions like it did when you were 18 years old again.
Is it potentially bigger?
So that's a great question. Now, in general, I would say the answer is no. The penile implant, if you come to me, and I was going to prepare to say this later, if you come to me and you say, Doc, I want my penis bigger, and I'm going to say, yeah, I can't do that. I can't do that with an implant. A penile implant, what I tell patients is it's going to get you harder, but I'm not going to get you bigger. In fact, some people, especially depending on their previous history, how long they've had erectile dysfunction, whether they've had surgeries like prostatectomies, often guys come to me, and I'm sure you've seen this too. They complain of shrinkage hey, Doc, listen, my penis has shrunk in the last 5 years, in the last 10 years. And there is this idea of atrophy, right? It is a muscle. You don't use it, you can actually lose it. So oftentimes when I have my patients in the room with me and I do the exam, I show them, I grab their penis, and this is not to be funny, I grab it and I stretch it. And I say, listen, this is probably what the length of your erection is going to be. Because setting expectations for everything when it comes to the penile implant is incredibly important, because if they don't have a good expectation of what they're going to get, they're not going to be happy. Can it make you bigger? The answer is no. I'm going to make you harder. And when I tell my patients this, I say, listen, I'd rather have a penis that is rock hard and maybe 3 inches shorter than a 10-foot dick that is softer.
Right. And you can't do much with it.
Can't do anything with. So, that's my rationale at the end of the day. And but some people don't want to hear that. And I was telling you last time we spoke, I've had patients actually say, listen, it's not for me. I want it bigger. And if I can't get it bigger, I'm not interested in the implant. And I'm okay with that. And the bottom line is what we're talking about as a penile implant is this is for erectile dysfunction. Now, while erectile dysfunction is incredibly important for a lot of people's overall quality of life, satisfaction, their partner's satisfaction, this is not life or death. No one's walking into the room and I'm not telling them they need to get a penile implant or they're going to die. This is not like prostate cancer, which we talk about. This is not like bladder cancer. For a lot of people, it may feel that way, and that's okay. And we can treat it. But
they may feel like it's or even worse than cancer, and they're going to die.
Right? Oh yeah. People say if I don't have my erections, I'm going to die. Like this is part of who they are.
Particularly in Miami, I presume more than other places.
You
right?
have no idea. But, but at the end of the day, this is an elective procedure. I'm not going to tell you you need this surgery. If you tell me you want it and it's important to you, I'm going to, as long as you're a good candidate and we agree on the expectations, I'm going to help you along the
Justin,
way.
what's your process? So here's why I ask. I remember with Dr. Valenzuela, and I don't know what exactly he does now, or what's his process now. But back in the day, he had them say, no. I mean, you try Viagra, and okay, try a lot bigger dose. Okay, let's try something else. And when nothing else worked, then okay, maybe you are a candidate for penile implant. I don't think that in my conversation with Dr. Carrion and Crespo recently, it doesn't sound like that's the approach that they use. They're like, if they want a penile implant and then optimize their sexual health, and they are healthy enough, otherwise, then we do it. It doesn't. So what's your approach?
So yeah, I agree 100% with that. So a long time ago, the erectile dysfunction guidelines did have an algorithm where they said, we're going to start every patient with erectile dysfunction. They're going to start with oral medications. Then they're going to move to injections. They'll move to vacuum erection devices. And if there's nothing left, then we do surgery and we do a penile implant. That has changed dramatically over the years. In the last few years, they changed the guidelines. They updated the guidelines. And now there is no true algorithm. What we say is, here are our tools for you to have satisfactory erections. Which one works for you? So any patient that comes in, I offer them every option. I say, listen, we can start with oral medications like Viagra or Cialis. If that's failed in the past, we can always try injections into your penis, often called trimix. We can try a vacuum erection device with a constriction band, also as cock ring. We can try a combination of all these things. And if you don't want to do any of that, that's fine. We can put a penile implant in you. And a lot of guys, listen, they don't want to inject into their penis, which I think is quite reasonable. A lot of patients, the data shows, they really don't, continue with it after about a year. The satisfaction rate for some is high, but not as high as other interventions. And I will tell you straight up, the penile implant has an over 90% satisfaction rate in patients who get them. Why? Because guess what? There's no more pills. There's no more injections. You have your.
It works 100% of the times, pretty much, right? I mean,
much, yeah.
And I almost sound like I'm selling this, and this is not the case. I just want to inform people so that they can make informed decisions. But I tell you, I became a fan throughout the years, and I recommended to the right patient. And if you've had a history of premature ejaculation, that's gone.
Well, that may or may not. Sometimes, premature ejaculation is one of those things that, when you have a penile implant, remember, penile implant does not impact your sensation. It should not. Maybe temporarily after the surgery, you can have a little bit of numbness, but most of that is gone. So premature ejaculation, I'll be honest, I don't know the data on it. Maybe you had read
I know no data. But let me tell you why I say this, so you can continue with your reply. You have premature ejaculation, and again, maybe it's likely that I'm oversimplifying. You premature ejaculation. This is a very tough thing for men, right?
I see where you're going with this. Continue.
Right? You have PE, and super frustrating, causes more performance anxiety. So then it causes other sexual issues. You have this implant. You inflate. It's up for the whole time, as long as you want, until you want, and you deflate. So there's zero PE in this situation.
I see what you're saying, but technically there is. I'm gonna rephrase it. I see exactly what you're saying. Yeah. In a normal situation, when you engage in sexual activity, you ejaculate, even if it's premature ejaculation. Say you last per our definition of premature ejaculation, lasting less than 2 minutes. Guys, if you're lasting 3 to 7 minutes, you're probably okay. Don't worry about it. But if it bothers you, obviously go see your provider. But in a standard penis, you ejaculate and your penis goes down. Exactly what you were saying there. If you have a penile implant, you ejaculate, even if you do have technical premature ejaculation, which is in 30 seconds, you can keep going, because exactly what you said. Now, is this a cure for premature ejaculation? I want to be clear. It is not. You're still going to ejaculate, but the difference is you're still going to have a hard-on and you can keep having sex. So I don't want people, I just want to be clear on that,
Yeah,
because I
that's
don't
good.
want people going to the doctor and being like, hey,
I have pee.
ejaculation.
I heard this podcast. You know what? I'm going to fly to see Dr. Dubin because he said that if I have premature ejaculation, implants. No, that's not what we're saying. Yeah, I got it. But the idea of the penis not becoming flaccid after you ejaculate and you continuing on does happen.
Oh, absolutely. Listen, I live in South Florida. I have a lot of older men with sometimes younger women, and they go, listen, I pump this thing up, I lay on my back, sometimes I'll just let them go at it, and then and that's something that happens, and people like them. You have full sensation, full orgasm, everything's the same, you're rock hard.
Yeah, literally. Let me ask you a question, because in our last conversation when you were on, and everybody look up our previous episode with Dr. Dubin and Dr. Gio podcast. And it's just extraordinary. We spoke about many things, including some of his studies, looking at clinics, these aging clinics, and how they're not all doing the right things. We spoke about pornography, and masturbation and all those things. Is it good? Is it bad? And actually, because of you, I had a conversation with Dr. Lisa Paz as a result, because great. You were like, I said, man, look, for me, porn is not great for ED. And you said, oh, hold on, maybe there is a positive. You need to talk to Lisa Paz. So it was like, I love where my views and beliefs are challenged, and you helped me with that. So I appreciate that. So look up Dr. Lisa Paz, Dr. Gio podcast, and Dr. Justin Dubin. We'll probably put it in the notes here. Many porn stars say, hey, man, I'm a porn star. I need a penile implant because I've never watched a lot of porn, and I'm not judging anyone or shaming anyone who does, but it's just never been my thing. But, right. When you're a teenager or whatever, I remember it's like, that can't be real. Like that, there's something off there. So I read things like they use Trimix, or they use things. How many of them actually, go for a penile implant because, hey, I need to perform well. That's what I do for a living.
This is a great question. And, I'm in God's country, Miami. That's here, right. where the porn stars.
God's country, thrive. AKA porn country. Right?
I mean, yeah. So what Gio's talking about, I did do a study a while ago. I was one of the first doctors to look at sexual dysfunction in male porn stars, male adult entertainers. And we looked and we found that a good amount of adult entertainers had erectile dysfunction. I believe it was about 39%. And I remember this number because you couldn't make it up. 69% of them were using some kind of erectile aid to help them. Now, in that study, most of it was actually oral medications. There was a small amount, and I don't have the study in front of me. There was a few who were using injections, Trimix injections. I do not believe that any had, said that or admitted to having a penile implant. However, I do know through having worked in South Florida, there are a potential handful that are around that do have that. Can I give a number or a percentage? I don't think so.
That's your next study, Justin.
Yeah.
That's your next porn study.
I would absolutely love to do that. But
what would be what's your guess? What's your guess? Give me
out of all of them, the porn stars? I don't know. I would say low. I would say
you 5%. Would say low. Why low? Look, if I'm a porn star, I'm going for it. I'm going all the way. And maybe, because you need to look, I don't know how the industry works at all. I don't know if it's a lot of filming and then they edit.
The turnover is high. So that's why. Yeah. I think that's why it's low. Because I don't think most people are doing it for long periods of time. Maybe they're doing it for men, it's probably 1 to 5 years, I think. And this is just me speculating. I know for women, the turnover is a lot higher. So if you're doing it for a short amount of time, necessarily, why put your body through something to achieve a goal that's
because I want to do it for 10. I'm devil's advocate because Dr. Dubin, I want to do it for 10 years, not 5. And if I can, if I can do this the way I think I could, my earning potential is way more than it is now.
I agree. I think what you're saying is very rational. Maybe you should go start Dr. Gio's porn. It's never too late if you got.
It's never too late. Though, yeah. Sometimes it's too late, but. if this podcast doesn't do well, then I'll have to do something else for a living, and maybe I have to get into that. That's so funny. Justin, you said something a bit earlier that I don't think I knew. So this is another reason why I love podcasting, because just when I think I got it all in urology, I'm learning something every day, particularly talking to people all the time. You said you can ejaculate with an penile implant. I'm not sure that I knew that. I wasn't even paying attention to that, because at least many of the men that I see who get penile implants had prostate surgery. So ejaculation is not even part of the conversation. But in men without prostate surgery, men with a penile implant actually still ejaculate?
Absolutely. There's no reason why they can't, right?
Right.
When we put a penile implant in you, we are putting the device in the corpora cavernosa. There's 2 chambers where the blood fill out inside your penis. And we put one part of the device in each chamber. We're not touching your urethra. We're not touching your pelvic floor. We're not touching your bladder.
Seminal vesicles. You're not touching the prostate.
Everything else is intact. So if you are someone who was ejaculating prior to the implant, there's no reason to believe why you cannot ejaculate after. Now, there are certain things that will prevent you from ejaculating, right? I mean, you mentioned one, prostatectomy. If you had a prostate taken out, you may have climacturia, which is urine in your ejaculate. Or you may have dry orgasms. If you have very poorly controlled diabetes, which is a huge population of men that we see for penile prosthesis, or if you have a history of long-term diabetes, you can develop something called retrograde ejaculation. And I often see this in guys, they just come in saying my semen volume is declining, my erections are actually okay. And that's because the nerves in your pelvic floor and the nerves in the muscles are not functioning as well when you have poorly controlled diabetes, as go your penis, as go your other nerves, right? So if you had retrograde ejaculation before, obviously you're not going to have ejaculation afterwards. But if you happen to just be a guy who has erectile dysfunction, who wants a penile implant, and who has normal orgasms and has normal ejaculate, there's no reason to believe that nothing should change.
Fascinating. Thank you for enlightening me, and I'm sure much of the audience, on that. What are some of the situations, conditions where you're not a good candidate for a penile implant? What would that look like?
Well, I think that
advanced type 2 diabetes, I'm thinking, like they're on insulin, or uncontrolled diabetes. What would that look like?
Well, I think that first we have to distinguish that there are 2 different kinds of implants, and maybe you're not a good candidate for one kind of implant, but you might be a better candidate for the other one. So,
differentiate between the 2. I guess that's a good
conversation. So I first want to start the inflatable penile implant. This is like the gold standard. This is the one I think that we all think about. There's a pump in your scrotum, and it's in the, and then it allows you to get an erection. You pump that like the Nike Air pumps, on the shoes.
You're dating yourself. I thought you were much younger than I.
I don't know. I used those when I was a kid.
I mean, yeah, exactly. Wow, I thought you were much younger than that even. Okay, good. I'm glad.
But it's a closed system of fluid, and it's usually sterile saline, and it has 3 main components. So it has the pump in your scrotum, which is going to be inside your scrotum. It's going to look like a third testicle almost, or feel like a third testicle. You shouldn't really be able to see it. You have the penile pump itself, which is the measured device that goes one in each corpora cavernosum. And then you have the reservoir, because it is a closed fluid system. So that fluid, when it's not filled inside your penis, when you're pumping it up, has to go somewhere else. And we often hide that. There's different techniques for different surgeons. I usually do not go in behind the bladder. I usually go behind the muscle in the abdomen, where it can hide away, where you don't see that. So that is one system. And then the other kind of implant is the semi-rigid. And basically these are just bendable silicone rods that we put in those corpora cavernosum. They're very simple. There's no pump. There is no reservoir. It is just the rods, and they bend. So and it pretty much it makes your penis look hard all the time. But because it's a silicone bendable rod, you bend it down in your pants when you're not using it, and you can bend it up
That
when
doesn't
it's
sound
time
good
to
to
get
me.
in
What
some
am I
sort of.
missing? That sounds painful
Um,
to me. That sounds
why?
like you're always walking around with a hard on, so you have to be careful with the swimwear you wear. That sounds like yeah, like you have something sticking out your pants all the time.
Well, I will say it doesn't get you as hard as the inflatable penile implant, so it's not gonna like blast you off. Like, you're not gonna be as rigid. You're gonna be rigid enough 100% for penetration. But for a lot of guys, who don't want to deal with the complexities.
I'm super excited about today's sponsor, which is Mr. Happy XY Vigor, a formulation to enhance testosterone levels and promote sexual function. Mr. Happy XY Vigor, or XYVGGR, was formulated by yours truly to optimize male hormones and free up testosterone and improve sexual health. It has an abundance of L-citrulline, which helps dilate and open up blood vessels so there's more circulation going into the pelvic area for better erections. Try Mr. Happy XY Vigor today.
It's something that maybe, yeah, if you're wearing a really tight bathing suit, maybe it's a problem. But I've put in a lot of these at this point, and a lot of the guys, as long as you set the expectation, you show them what they're dealing with. I've had guys who are incredibly happy. And, so when you're talking about who's a good candidate versus not, I think one of the biggest things that I look at, if you're interested in an inflatable penile implant, we had already discussed the ability to pump up your scrotum. So if you are an older gentleman, you have very poor arthritis,
Right.
you don't have any good grip strength. I always have my patients, whenever I'm interested in seeing if they're strong enough to pump the implant, I put my hands out, I say, squeeze my hands as hard as you can. And if you can't do that, you're probably not going to be a good candidate. You have to have good pincer grip strength. If you are someone who, just is very intimidated by the process of having an implant in you or a pump in the scrotum, trying to figure out a component and you just know yourself that you don't want to really be taught these kinds of things, you're also not and that's the truth. People should know themselves, right? I've had multiple guys come in. I give them, they go, I don't want the bells and whistles. It's too complicated for me. I just want to be able to have sex. And then boom, I put in the semi-rigid and they're very, very happy. An interesting thing that I have offered to some guys, and there's limited data on this, but there is data for more complicated patients who have had multiple abdominal surgeries. I often, or have kidney transplants, you can put an inflatable implant in them, absolutely. But sometimes I do lean towards the malleable, the semi-rigid implant, just because it's a little less complicated. There's less risk of infection in these because it's, once again, there's one component, there's not three. So the risk of infection, complications is a little bit lower. And then what was the other reason? Oh, for obese people with hidden penis, I have actually put a semi-rigid in. Why? Because if your penis is rigid all the time, there is data showing that it extends your penis. I can't make you bigger, but I can make you look like you're erect. And if you look like you're erect, your urethra that and your penis that may have been buried is a little less buried if you're obese or you
So
have
it could
buried
help
penis.
for non-erectile
It can help
issues?
you peeing. It can help
Yeah.
you pee.
Wow. Okay.
So there's some data on that for buried penis and
Right.
oftentimes when they're doing reconstruction for it, they will put that in. So
All right.
it's just like an extra wrinkle that I
Right.
have. I've done it once for a patient, but I know that there are some situations and there is literature supporting that idea. The other things that you have to be concerned about when you're deciding whether you're a good candidate for a penile implant is diabetes, right? And I think that's a big one that you had brought up. Now, the literature on this, and you talk to a lot of people, it's quite controversial. You have a lot of implanters, the high volume guys say, listen, I don't care what your hemoglobin A1C is. It's about how fast we do the surgery. It's about your sugar control the day of surgery to reduce the risk. And, when you're a poorly controlled diabetic, your immune system, you're a little bit immunocompromised. There's data suggesting that the infection rate is higher. And when we're talking about a prosthetic, device, the scariest thing that we don't want is an infection.
Mm-hmm.
For me, I have a cutoff. I have a cutoff of hemoglobin A1C of 8. I want you to have a hemoglobin A1C less than 8.
Less than
Which
8.
I
I
think,
think that's pretty
yeah,
good. I thought you were
do
going
you
to say like
think?
6. I was like, man, I see
No,
6s all the time.
no, I'm saying less than 8. But you would be surprised. I see a lot of guys who come in, they're at 10, they're at 12.
Yeah,
And
uncontrolled.
poorly controlled. And, I find it as a good way to intuit things. One, I see how motivated they are to really get their health and their erections together, right? Because so if they're going to get this under control, I'm like, okay, this guy really wants the implant. We're going to do it. And two, know that this guy is really going to listen to what I say afterwards, right? Because one thing about as an implanter myself, and I learned this from Dr. Bennett, and I really liked how he put this. He was my mentor at Northwestern. He said, listen, when you put an implant in someone, you put a prosthetic, you own them, right? Like you are part of them, right? Like you have put something in them. If something bad happens to them, they're coming to you. They should not go to anyone else. And I take that very seriously. And I have that thought in my head, like, I'm going to put my best foot forward. So I need my patient to put their best foot forward because we're in this together. This is an automatic binding partnership. Like your penis is my penis. It's our penis, and I'm going to make it the best penis for
Your
you.
penis is my penis, Mr. Jones.
I say that a lot. I truly do say that to my penis.
I own your penis. You can't, right? Yeah.
Yeah.
I often tell my patients who have like these prostate issues, and sometimes I feel they go into urologists that are too aggressive unnecessarily. I tell them, look, your prostate is no longer yours. Your prostate is mine, and you can't do anything to that thing without talking to me. And so I feel like that's what you do with your patients.
Absolutely.
You mentioned something that is fascinating, and once again, I didn't think about that. Some men get a penile implant for reasons that have nothing to do with erections. For reasons like they have difficulty urinating because they're obese, the microphallus maybe, and which is short, small penis. And so then you put this implant in, and they can, if you're obese, now you can actually grab it. You can direct your penis towards the urinal or whatever, and you can urinate well or urinate better. I didn't think about that.
Yeah, it's one thing that, it's not done commonly. There's several papers on it. But I think that there is a role for it. I'm not saying everyone with a micro penis or like a hidden penis or buried penis, this is a solution. Because I think at the end of the day, the buried penis, there's a lot of plastic surgery to be involved. There's penectomies. There's all these other things that are to be considered, but it is a potential thing at play with this. I think one of the things that we're kind of all highlighting here, and something I wanted to highlight right out of the gate was, all these things that we're talking about. If you have erectile dysfunction, there's probably something else going on with your health, right? What's good for your heart is good for your parts. What's good for your penis is good for your heart. So if you are someone who has erectile dysfunction to the point where Cialis isn't working, Viagra is not working, and you haven't seen at least a urologist yet, you got to go see a urologist. You probably should see a primary care doctor. You should consider seeing a cardiologist or something. Right. You should probably get a full workup because something is potentially going on. We know that erectile dysfunction is a canary in the coal mine.
Yeah.
It's a great predictor for people to have heart attacks, unfortunately. So like, it's an embarrassing thing to talk about, but if you don't talk about it now, you might be talking about a heart attack a few years down the line.
That's a great point. I say that almost as often as I can because I do believe that the one thing that we have that women don't have is a penis, and it to me is a barometer to your health. So regardless if you use it or not for quality of life reasons, whatever, in spite of that, you don't have any erection for over I don't know 3 months or so, and zero erection. I didn't wake up with one. I didn't use it. I didn't masturbate. I didn't nothing. Red flags are coming up in my head for sure. There's probably some other systemic thing going on for sure. That's great. Back to penile implants though. What is so in men after prostate surgery, sometimes they have incontinence issues. So if a man has 2 questions actually, after a prostatectomy, they get their prostate removed and they get a penile implant, do they need to be continent In other words, some of these guys have, urinary incontinence after that. Is that mandatory?
It's a
And
great
or
question.
what do you do? Can you get a twofer? So
It's
penile implant and a sling at the same time, or whatever. How does that work?
It's a really good question. Now, there's different approaches to it. So, first off, I think the continence really depends on the patient preference and the physician preference too.
Yeah.
So, I think that my personal stance is if a patient is bothered by their incontinence and they have severe incontinence or bothersome incontinence, I personally prefer that they get their incontinence treated prior to the erectile dysfunction, because the way that I see it, what does incontinence do? It causes leakage of urine. And if you do penoscrotal, there's different approaches to doing a surgical, to doing the surgery. And I had alluded already, we really want to prevent infection. So if I'm doing not a surgery on an implant with a patient who's incontinent, most of the time, obviously, there's going to be a catheter in during the surgery. That's not going to be the problem. But afterwards, they're not going to walk around for, they're maybe going to have the catheter in removed the same day, if not the next day. There could be leakage of urine around the site. And for me, that is a concern for infection. So if someone's truly very, very incontinent, listen, there's as you know, I'm
Loose
sure you talked
rules,
about,
loose definitions.
and there's a lot of gray, and there's a lot of variability in incontinence and how.
Yeah, I'm talking 8 times. They change 8 pads a day.
Yeah, no,
I'm talking where it's obvious.
I would say, so me personally, I would say go fix the incontinence first, and then we'll fix your erections.
Can we do both?
You can. Some people do. There is some literature doing it. I do not. I don't do that, but I'm not saying it's wrong. I think that there's some good data showing you can do both, and it's successful. And if you can do it, why not? I'm all for it. It's just it's finding the right surgeon to do so, right? And that's like everything, right? You want to ask how many they've done before, how often they do this, and it's important, right? But I'm definitely for it. I know some excellent surgeons who do both at the same time.
Justin, if I'm a surgeon, and every surgeon starts somewhere. No one becomes a surgeon and says I've done 1,000, right?
Right.
I think that I would raise the amount that I save by 20%.
Interesting.
Because if I don't, why would this guy do it with me? And I know I'm good because I'm trained with the best. And let's say I'm trained with the best. How often do you think that happens, right? At the end of the day, look, I tell people, and again, I'm not a surgeon. I don't want my body open. I'm a natural guy. But I try to look at things objectively, and all I care about what's best for my patient. That's all I care about, and leaving out my biases.
Well, I will tell you that I think most people don't ask that question, to be fair. And I think that there's
a good question to ask.
Yeah, I think it's a very good question to ask. But I also think that, it depends on several things, right? One, if you're a tertiary center and you were referred by another urologist or another provider, I think that there's an inherent trust built in that process. Two, if you're in a area where there's not many other people doing it, you may not have a choice with the person. Of course, you always have a choice realistically if you are interested, and we have people fly wherever they need to go to get things done. You're at NYU, you know that better than anyone.
Yeah.
But I do think, asking the question is important. You don't want to do it with, I don't know. I don't know what the end number is to say, like, you shouldn't be getting it done by this person, because you're right. Like, there are a lot of very, very good urologists, very good surgeons who are maybe not doing as many to start, and then they start doing 1 million, right? Like,
correct.
There's a journey. There's a journey that there is, as you were alluding to.
Let me give you an example. I had a guy come in today who probably needs prostate cancer surgery, and he says, "No, I'm going to go with Dr. X because he's done 9,000." But why aren't you going to Dr. Y? Well, Dr. Y has only done 4,000. And meanwhile, in my head, because I see these patients that go to the book, I like Dr. Y even more than Dr. X, right? So I kind of try to help him reframe that. It's, look, after a number, and I don't know what that number is, but after 1,000, I don't know, unless there's some anatomical difference going on that is rare. I don't know that after a certain number, going to the guy that has the higher volume is necessarily better. But particularly if I feel more comfortable with the guy that has less volume. What are your thoughts on that?
I think that you're right. I don't know what the threshold is. I agree. Like, doing 5,000 implants versus 2,000 implants, I don't know what the true value and difference is there, right? I think that, and everyone has their own little way of doing things. And,
Yeah.
the other thing is that you do enough implants. And there was a great talk of this at the SMSNA, the Sexual Medicine Society in North America.
Which I'm speaking, by the way. I
Oh,
got
yeah.
my
Oh, hell
abstract
yeah.
got
You're coming.
approved,
Let's
and so we're going to
go.
talk about herbal medicine and testosterone.
I love it. I'm going to be
Yeah.
talking too. I'm going to be talking
Oh,
about
it's going to be fun in Arizona.
Yeah. Oh, it was at SMSNA at AUA. I can't remember who gave the talk. I'm selling them short because it was a fantastic talk. And they basically broke down how to quantify, like the elite skilled implanters versus like highly skilled
Okay.
versus like very good implanters. And I think it was mostly off of complications, believe it or not, right? Like if you're the guy who like sends their complications out to someone else, whoever is receiving it is probably going to be the higher level of implanter. If you're getting the worst of the worst, you're probably the highest level implanter. So
Oh,
it's
okay.
often not in terms of quality, it's almost quality and the difficulty that you're receiving at some point, because people are knowing you for that, than the
Ah,
volume, if that makes sense. And
interesting.
that's, and I think it's a fair way to look at it, right? Because I think your
Wow.
skills are always challenged in the most difficult of cases, right? Just like anything, your personality, your
Yeah.
character,
Yeah.
in the face of difficult times is where
Yeah.
you really stand out as who you are or what you are. So like, yeah, I think in a standard, straightforward penile implant, there's so many across the country who can do a wonderful, wonderful job. And even if they did 5 a year, you know what I mean? Um,
Mm.
but I think if you're more complicated, you've had multiple revisions, you've had some issues in the past, you have some kind of weird anatomy, I think that maybe, yeah, consider going to one of those higher volume implanters. If that, and that's why I don't want to give a number. I don't want to give it like
Yeah. No,
it's
that makes sense. Actually, the way you just defined that makes
and
sense.
I don't want to take credit. I just can't remember who gave the talk, but it was an awesome talk.
Oh, okay. Hey, what's the future with penile implants? So everything is moving in a way there's some technology involvement in everything.
Yeah.
Talking about AI, I don't know. Can I press a button, on my table, and that button is connected to my penis, and so there's no thing between my scrotum where I have
I
to
hope
press.
so.
It's just
I
like
hope so.
so there's less manual dexterity that's needed because I just press this button. I could press this button with my elbow. I mean, what's in the pipeline for penile implants, as best as you know, or you think?
I think there's some really cool, potentially interesting stuff coming down the pipeline. I think one of the biggest things that we have to try to figure out is, when I describe the penile implant, the inflatable penile implant, there's two things that I think are concerned, right? One, I talked about your ability to pump the device itself. Now, if you have, hand strength issues like we talked about, or there's a potential learning curve there that some people get intimidated by, that may prevent you from doing a penile implant inflatable. But what if it was Bluetooth and you pushed a button on your phone and you could just get an erection? And that's what some of these companies are currently working on.
Bluetooth. I
Bluetooth
guess the
penile.
limitation is the battery life. No.
Yes. So I think that is kind of the rate limiting step right now, is my understanding. I have no inside knowledge in this capacity, but I think finding a battery that is not big and is safe to last in the body, I think is what, and I think they have those for like pacemakers and stuff like this, but this one obviously has to do a lot more, right? You have to have enough juice to deflate and inflate a penis, right? So I think that that's kind of what one thing is, if we can remove this pump component, I think much more people would be eligible for the inflatable penile implant, which, like I said, is pretty much the gold standard.
Yeah, I have all kinds of images in my head, Justin. So you're ready, and it's ready to happen, right? And you go, and where's my phone? Shit, I can't. Oh, there's my phone. You like the battery's like at zero almost, and
Well,
right when you're about to press that button, your phone goes out, you runs out of battery, right? It's like, oh my god, you're looking for a cable there's no cable. I don't know.
Well, I'm sure the original, the first versions will still have a penile pump in the scrotum, like
For
right as a
backup.
backup. to back up, deflate it, inflate it. But imagine someone hacking into your phone and then just
Oh,
inflating your
that is
penile implant.
even better. What the heck? What's happening here?
um, that would be funny. But I think the other thing that we need to start thinking about is with infection, right? So, one of the biggest technologies that we've seen an improvement in penile implants in the past was antibiotic coating of the device, right? So all these devices, no matter what company is using it, these are antibiotic coated. And, these microbiomes of the implants have changed dramatically over the years based off of what our antibiotic regimens
Right.
have been.
I can
I
see
think
that.
the most common one is right now staph epidermidis,
Mhm.
which is and some potential fungus, which like there's a gram-negative cocci. So we change our antibiotic regimens based off of this. Now, if we can come up with better solutions for antibiotic regimens or more successful, antiseptics, or there's been trials of like UV radiation onto devices to see if we
Yeah.
can kill bacteria to prevent infection. That would be a big one. And along that lines is removing the reservoir, which is one of the components, right, where the fluid is. If we can create a better device. Now, there is a two-piece inflatable penile prosthesis, which is less popular. I've put a couple in over the years, but basically how it works is the pump directly fills into the fluid into the device. There's no reservoir. And in order to deflate the device, it's kind of disturbing. You have to crack the penis. Like you bend it like like a glow stick, and it makes a little crack noise, and then it deflates. So I think that's one of the reasons why people have stayed away from it, but it's a
I
good
don't want to hear
device.
my penis cracking. I don't know. Is it me? Like, I don't even care that it's something inside of it that this is. I just don't want to hear my penis cracking. Even
Right.
thinking of
No,
that. Yeah.
I think that's
There's a lot
reasonable.
of room for improvement, don't you
Yeah,
think? I think that,
removing components, like trying to make it as simple as possible, as easy as possible for people to use in the safest manner possible. And there's so many people who are getting these devices, and they're becoming more popular every day, especially unfortunately with increasing rates of erectile dysfunction, diabetes, prostate cancer treatment. There's so many causes or reasons that people are getting them. And so like we need to be, proactive in trying to provide the best, safest opportunities for patients to get a satisfying quality of life with good erections.
I love it. What's the infection rate? How often? You've said that a few times, and I guess so. If a person is healthy, no diabetes, probably almost zero chance. Nothing is zero in
It's
medicine.
about 1 to 2%.
Yeah,
1 to 2%.
total.
The diabetes, it increases about 3 to 4%. The literature varies there. So it actually almost doubles, right? The other things to consider when you do a revision, if a penile prosthesis breaks down, one thing that we didn't talk about, how long do these things last? About 85% of them last 10 years, so I mean, they last, right? Like people are, you shouldn't expect to have to use it to redo
If
it,
I use
but
my
that does
penile
happen.
prosthesis more than the average guy, so let's just say I'm going to exaggerate. I'm on every day. I'm
Yeah.
exaggerating. Now, is the lifespan on that? Is it wear and tear issue? The lifespan on that
You
shorter?
can have wear and tear. There's about a 2% mechanical breakdown, early mechanical breakdown risk. There is a wear and tear. I have seen guys, and I've repaired guys. I've recently repaired a guy. He was just incredibly sexually active. He had a penile implant like 6 years ago, and like sometimes there's a lot of tubing, sometimes it
Yeah,
rips, sometimes something happens,
yeah.
sometimes there's a leak. We replace it. He's already having great sex again. So there are, of course, extenuating circumstances, but in general, you should expect this implant to last you most likely at least 10 years from when you're getting it.
Dr. Justin Dubin from Memorial Healthcare System. Man, it's so great to have you on. Not only we have great conversations, but love your energy. I mean, look, you're a podcaster, so it all makes sense. And it's so much fun having these type of conversations with you. So thank you so much for being on, Justin.
Oh, this was great. I always have a great time with you because you bring some really refreshing perspective and interesting angles, and you truly are interested.
Yeah.
And I don't
Yeah.
feel that from everyone,
Yeah.
but I always feel it with you. You're truly, truly interested. You're trying to learn along with your audience. You're trying to do the best for for your listeners. And that's why they love you. And that's why you're so successful. So it's awesome.
I'm always thankful for Robert Valenzuela, because I chose, you know how Michael Phelps is like, man, you can really, with your body, you can only be a swimmer. You're 6'4", but your body type is not for basketball, right? God bless you that you did your thing, that what you're really good at. And you didn't say, I want to be a track runner or a basketball player. Same thing happened with me. I'm like, I never get enough. I'm always, just prior to our conversation, I was like, man, what's the history of penile implants? So I was like looking all this up in 1930s and, forward. So it's fascinating. Justin, how can people find you?
So, yeah, as you said, I'm a urologist who practices men's health, male infertility, sexual medicine, andrology in South Florida at Memorial Healthcare System. So I have offices all in South Florida. If you're interested in getting care, I'm available there. I can be found on all my socials at Justin Dubin, MD, on TikTok, Instagram, Twitter /X. I have the Man Up podcast. It is on all podcasting platforms, Spotify, iTunes, Amazon Prime, not Amazon Prime, I guess Amazon. And then those socials are at the Man Up Pod, and you can also find us on YouTube. So I'm all over the place, just like you are. And I want to thank you again so much for having me on. This was always so fun, and I look forward to doing it again soon.
I think we're going to have to. Thank you so much. Thank you, Dr. Dubin. So much fun, guys. So much fun. Look, the goal here is for you to be well informed with good, quality, valuable information, for you to be proactive, a significant person in your own healthcare, and so that you have better conversations with your physician. This whole notion of shared decision making, you can only be part of that conversation if you know what you're talking about. That's what this is about. So we get the best on all things, even things that I don't do. Natural, conventional medical treatments. Penile implants, I think it's an important thing for you to at least know about. And if you're really interested, quality of life, I think you should get educated. Hopefully this podcast series, 4-part series, gives you all the information you need. So thanks so much for listening. Much love to you all. And I will see you next time. All the best. Thanks for tuning in to this week's episode of the Dr. Geo podcast. You can watch all episodes of this podcast and much more by subscribing to my YouTube channel on youtube.com/Geo Espinoza ND. If you love what you heard today, you can help by leaving a 5-star review of the podcast on Apple and Spotify, as each review helps us reach more men who are serious about improving their urological health and how to function better with age. And for the latest research and actionable takeaways in the world of men's health and integrative urology, sign up for my newsletter at drgeo.com. I'll see you next time.